prevention of pressure ulcers. What are pressure ulcers? They are injuries to the skin and or underlying tissues resulting from prolonged pressure on the skin. They can also be called bed sores. They develop pretty quickly, and most people at risk are people that aren't moving around a lot, laying in bed, a lot of our nursing home patients. These are hot spots that pressure ulcers have. It's just happen. So a lot happen on the bottom, hips, knees, and ankles. That's where I've seen them the most. I've never really seen one on the ear. I do know you can get them from the nasal cannulas too. And then there's a bunch of different stages of pressure ulcers. This one's more of like just a reddening spot on the skin, starting to break down, starting to get like the fatty tissue. And these are pretty bad where a lot of dead skin forms. These are more realistic photos to see. They're a little disturbing.
Okay, so when you're assessing a person to see if they have pressure ulcers, you're going to first inspect the areas by first looking for discoloration and abrasion. So the skin should be intact, and there should be a brisk calc refill when you palpate the skin. Some abnormal findings are inflammation, redness, abrasions. And so then after you inspect, you're going to palpate. So the temperature of the hot spot should be the same as the surrounding skin. And if it's not, usually it's warmer, so that indicates inflammation or that there's actually blood trapped. And then another thing is to assess over the bony prominences. The tissue should be firm, not hard, and it's the same consistency as the surrounding area. And if edema is present, edema is indicated if the tissue is spongy. So when you're predicting a pressure injury risk, you're going to usually use the Braden scale. And so there's 6 subscales that are part of the Braden scale, which is sensory perception, moisture, activity, mobility, nutrition, friction, and shear. There's 23 points that are possible. And if someone scores below 18, they're considered at risk for developing a pressure ulcer. And that's what the Braden scale looks like.
The diagnosis that we have for pressure ulcers is impaired skin integrity, which is the skin being adversely altered. The next is a risk for infection and increased risk for invasion by pathogenic organisms. And then we have a risk for ineffective health maintenance. If a patient or hospital staff is not taking care of the pressure ulcers and they are developing into worse stages, according to Wiley.com, it's a pattern of regulating and integrating into daily living a therapeutic regimen for the treatment of illness and its sequelae that is unsatisfactory for meeting specific health goals. So basically, don't allow the ulcers to get into worse stages.
All right, so our goal as nurses is to maintain the skin integrity, to keep the skin clean and dry, and to investigate and assess for incontinence. We need to avoid vigorously drying the skin when cleaning the patient's skin and report altered sensation or pain. We also need to reposition the patient every 2 hours if they're at high risk for a pressure ulcer. We need to teach the patient on how to maintain their skin integrity, like once they get discharged. And we also need to teach the patient or the caregiver how to care for the wound and to prevent infection and making the ulcer worse.
Alright, so now for the implementation and prevention of pressure ulcers, you want to make sure that you change positions or turn the patient at least 2 hours, every 2 hours. Use pillows, heel protectors, and wedges to decrease the pressure put on bony spots of the patient. Apply barrier cream to redden areas on the skin to help reduce the chances of increasing damage. They have air mattresses that can help reduce the amount of pressure. Keep the patient clean of urine and bowel incontinence to reduce skin breakdown. Keep patient skin dry. As nurses, try not to leave like cords, caps, anything, equipment, and tubing underneath the patient because it can cause skin breakdown. For nutrition, you want to make sure you eat lots of protein, nuts, eggs, take zinc, vitamin C, A, and B, and supplements like Ensure or Core Power. This helps promote tissue healing. At least 2,500 milliliters of fluid a day unless contraindicated. For prevent infection, proper hand washing, appropriate PPE for nursing and visitors. Help patient with self-dignity and low self-esteem. Let patient be involved in the care if possible. And then check skin under equipment for breakdown behind the ears or the mouth or the chin from like intubation tubes, nasal cannulas, things like that.
So overall, our main goal obviously is to keep patients from developing a skin ulcer. So for our evaluation, no skin tears will occur in at-risk patients, like Maddie said, especially the ones that can't move or just critically ill patients. We will promote skin tears that will occur, will heal properly. Just provide like a safe environment in general that promotes adequate skincare. Malnourished patients should be tested for a swallowing evaluation and should encourage protein and calorie-rich foods to promote proper wound healing. And if patients do have a skin tear, just remember to follow up and reassess for any new skin tears or worsening of current skin tears. And then just follow up for adequate wound healing and tissue perfusion.
And we're gonna upload the video or the PowerPoint to our video so you can actually see it.